welcome to this edition of Wake Up and Live with the Arts. I am Sue Johnson, the producer and actually the director, and I'm here with James McGilbray, who's our videographer, and Lester Bryant Sr. isn't here, but he is our editor, so we get this show out to you. It is my pleasure, and I have to say, to finally get this busy man here, Dr. Charles Modlin of the Cleveland Clinic. What's its whole name? CC Foundation.
Well, actually, we don't go by the foundation anymore. We just call it Cleveland Clinic.
Oh, really?
Cleveland
okay.
Clinic, yes.
And what do you do there when you're hanging out, doctor?
Spend a lot of time there. A lot of my spare time I spend there taking care of patients. I'm a urologist and also a kidney transplant surgeon. Right. I've been at the clinic now for about 25 years.
Okay, and you do surgery for kidney work and for urinary work.
Yes, and I'm also the founder and director of a program I started. It's called the Cleveland Clinic Minority Men's Health Center.
And that is what we'd like to focus on today, is because it's coming up in April 19th to be specific.
Yes.
It's an annual event, and the purpose primarily is to encourage and make aware, especially minority men, to get health care. Tell us about the fair.
Sure. So we actually have activities year-round in our Minority Men's Health Center, but the health fair is an annual event. Thursday, April the 19th, we're going to hold our 16th annual Minority Men's Health Fair. And again, it's a free health fair. We do health screenings from head to toe. We screen for diabetes, high blood pressure, heart disease, kidney disease, hepatitis C, HIV, peripheral vascular disease, stroke, mental health. We're screening from head to toe. We're having free health examinations, medical assessments, ask the doctor segments. And we do this because in particular, men of color, especially men of color, and the health fair is open to everybody regardless of race or ethnicity, but men of color have the highest rates of what we call healthcare disparities.
Right.
And healthcare disparities just refers to the situation where a certain segment of the population suffers disproportionately from a variety of conditions that I mentioned. In case in point, black men, African American men, on average live about 7 or 8 years shorter life expectancy than white men. And a lot of that is attributable to the healthcare disparities that I spoke of.
Right. Do you include Hispanics and other minorities?
Absolutely.
As well?
Absolutely. Hispanic males have a higher incidence of diabetes, for example.
Okay.
Asian Americans, actually the highest incidence of hepatitis and liver disease.
Okay.
Native Americans, Pacific Islanders, and white men. Everybody is invited.
Yes.
And sometimes we actually have some women sneaking in there, getting their blood pressure checked and glucose checked. But we specifically target men of color because they historically, for a variety of reasons, they've shunned doctors. They've been reluctant. Many men have been reluctant, not all men, but many men have been reluctant to go to the doctor, get preventative health screenings. It seems like women are educated at a much earlier age about the importance of going to the doctor.
Why do you suppose that is, that men, and particularly black men or men of color, are so reluctant to get health care? What is our psychology or our culture behind that thinking? Well,
there are a lot of barriers that have contributed to the health disparities. A lot of it has to do with lack of access, poverty. Some of it has to do with lack of or deficiencies in health literacy in terms of knowing what is important, what type of screenings one should have, when they should start screening for certain conditions, hereditary causes. But there's a fear factor also, and I think a lot of men are fearful, and my dad was this way. He didn't want to go to the doctor. He didn't want the doctor to tell him that there was something wrong.
Yes.
There's a lot of distrust. I mean, historically, we've all heard of the Tuskegee syphilis experiment.
Hold on. And if you haven't lived on this planet for very long, but I call him Charles, but Dr. Modlin.
Sure.
Would you give a brief history of what the Tuskegee experiment was?
Sure.
Okay.
So the Tuskegee experiment, well, the United States Department of Public Health, and this is, I forget the exact years, back in the 20s, 30s, 40s.
20s and 30s.
30s, yes.
Yes.
They had a group of about 800 African American males over that period of time who they knew who were diagnosed with syphilis.
Right.
Active syphilis. And there was a cure at the time, penicillin, but they deliberately, the United States federal government deliberately denied these men, these 800 men, treatment.
Exactly.
Because they wanted to see what would happen to untreated men with syphilis, the natural consequences of untreated syphilis. And, by denying these men their treatment, men suffered. And actually their families, they transmitted syphilis to their partners.
Yes.
And this actually leaked out. And so, as a result, a lot of times, we, people of color, not just men, but a lot of us were fearful of going to the doctor. And especially, we're fearful of participating in research, clinical research trials. And the fact that we don't really participate the way we should in these clinical research trials contributes to the healthcare disparities. Because, for example, 90% or more of the medications on the market to treat hypertension and other conditions have been tested, developed, and designed by just testing white men.
Okay. Oh, that's the same as women
Yes.
have just, not just, but recently came into getting the same attention
Exactly.
as males when it comes to health care.
And so this has all contributed to the fact that we have these health disparities. I think also there's when you talk about black men, men of color, there's and this is what we're seeing in the community, and I think there's a sense of hopelessness and helplessness in many instances where a lot of times, black men, for various reasons, think that nobody cares what happens to them. It doesn't matter if they die.
Yeah.
I mean, who cares is what, they feel. And so, if somebody feels that, they're not needed or wanted and nobody cares, then they're not going to be motivated as much to go to the doctor and take care of themselves. The other thing is a lot of men feel that if they don't have any signs or symptoms, any pain, aches, complaints,
Drips, leaks,
yeah,
whatever.
that there's nothing wrong.
Right.
If they don't feel anything wrong, any pain, then in their minds, a lot of people think they don't have any issues. And I can tell you, definitively, a man can have prostate cancer, even advanced prostate cancer, and have no signs or symptoms.
And it's become more common knowledge, I guess. Men can have breast cancer.
Exactly. Richard Roundtree, the actor.
Oh, yes, yes.
Whom you know.
He was Shaft way back when.
He had breast cancer. He was treated for breast cancer.
Uh-huh.
And I mean, I've seen some men in my clinical practice, and we tell men, do your monthly self-testicular exam, do your monthly breast exam just like women do. Because again, men can get breast cancer. A lot of men don't know that.
Right, and
So-
that's what your fair does. It makes folks
Yes.
aware.
Mhm.
It teaches. It shows them how easy to conduct these tests are. And one of the standard comedy tests that the comedians do is about the
prostate, right.
the prostate
Yes,
test.
yes.
Nobody's sticking a finger in my behind.
Right. Well, the other thing is, and a lot of black men, men of color, men in particular, they want to be very macho, and there's a kind of a stereotype. Well, if you go to the doctor, let them do that. I mean, that's but again, it's to save your life. And the other thing is, there are different ways to detect or screen for prostate cancer. One is the blood test, the PSA prostate
My dad had
specific
that.
antigen blood test,
Right.
and the prostate exam. We like to do both, but I always tell people, we're not going to hold you down. We're not going to force you to do the exam. I mean, at least come to the health fair and get a blood test.
Yes.
Just get a blood test. It's very easy. The blood test doesn't mean you have cancer. It means if it's elevated, that you may need a biopsy.
Yeah, just keep your
Yes.
eye on it and watch what happens
Exactly.
with that PSA level.
And the other thing about the PSA level, what is considered normal depends on what your age is, the decade
Right.
of life. So if you're in your 40s, 2.5, in your 50s, 3, 60s, 3.5, so it varies. And we want to be more aggressive in terms of screening black men, because black men develop and die from prostate cancer twice as often as white men.
Right.
So, and especially if you've had a first-degree relative, who's had prostate
Father,
cancer. Yeah.
brother.
Yeah.
Yeah.
And that exponentially increases your risk for developing, prostate cancer.
And it's almost
So-
the same for breast cancer for
Yeah.
women.
Oh, yeah,
If,
yeah.
The more immediate family members,
Exactly.
your chances of perhaps contracting it
Right.
increase.
And, we know diabetes can have a hereditary component, high blood pressure, heart disease, mental health,
Yeah,
mental
and
illness.
you know what I've noticed on the commercials lately, and this is fairly new information because I heard it the first time 30 some years ago. A family friend had diabetes,
Okay.
and he keeled over, it turns out, from a heart attack and a stroke. I didn't believe it,
Okay.
and now 30 years later, they are using commercials to say
Yeah.
that if you are diabetic, you have more chances of getting something like heart attacks and
Sure.
disease and stuff.
And peripheral vascular disease, I mean, many diabetics, advanced diabetics, if they don't take care of themselves, blacks are more likely to have the sequelae, requiring bilateral lower extremity amputations.
Yes.
From ulcers and gangrene and things like that.
Right.
So diabetes basically affects the small vessels in the heart and the brain, in the kidneys, and in certain areas that really concern men also that we don't always want to publicly talk about, that urologists treat.
Yes.
And so there's a reason to try to prevent the onset of diabetes, high blood pressure, or at least try to control it, because then it can lead to unwanted consequences. But we can address those. But so I say every man needs a urologist in addition to a primary care provider, because you look at women, most women have a gynecologist, right?
Right.
And so urologists are the corollary of that gynecologist to men. We specialize in men's health, needs. We take care of women also, but especially, the male reproductive system in addition to the urinary system. Every man needs a urologist.
Okay, and you're going to make all the folks aware of and provide free testing at the 16th Annual Minority Health Fair, and it'll be held in 3 locations this year. At Cleveland Clinic main campus, everybody knows where that is, on 95th and Euclid. Question, by any chance, is there valet parking or free parking? Or
Well, we have valet parking, but also it's free parking. We're opening up the JJ parking garage.
Okay.
That's on Euclid Avenue, actually between Euclid and Chester.
Chester, okay.
So yeah, that's free parking there. And we're trying to break down all the barriers that prevent the guys to come in.
Yeah.
So no, free parking, free health screenings. I mean, if you were to tally all the costs for all these lab draws, blood draws, examinations, consultations, you'd be paying probably $5,000 or more.
Exactly.
I mean, just for this single night, to have all these examinations. You can kind of pick and choose what you want, but I say come early, get everything.
Get everything.
Get everything.
Right. And along with the main campus, you also are going to have simultaneous Hens Milk Fairs. Yes, Hens Milk Fairs out at the Cleveland Clinic, the Akron General Ambulatory Care Center. So now you're having a men's health fair out there also.
The Akron General Hospital. We bought Akron General Hospital now, so that's our hospital down in Akron.
Is there anything you don't own? I mean, you drive on any street corner practically, and it's whether it's administration or medical, it says Cleveland Clinic.
Well, we're trying to take our expertise out to the community and make it easier for people to access. And we're going to be in Lorraine Family Health Center
at the
also.
same time.
Same time.
And so, would you tell us the time again? Oh,
sure.
Yeah, I'm sorry. Cleveland Clinic Lorraine Family Health Center. That's on Cooper Foster Park Road in Lorraine, and the Cleveland Clinic Akron General Ambulatory Care Center is at 1 Akron General Avenue in Akron. But certainly if you call the main campus, they will tell you, what's closest to you so that you can take advantage and not have any excuses for not attending the 16th Annual Men's Fair.
Yes.
Founded by his truly, Dr. Charles Modlin. So you've been doing a great job, and it's been a tough process.
It's been a gradual process, but I'm grateful. Again, we're going to be at the main campus where we've been also, but I'm grateful. We're going to have over 400 volunteers there.
Okay. Yes.
I mean, these are dedicated volunteers.
And they're medical staff.
Medical staff, some from the community, but the majority are Cleveland Clinic staff. They work all day, their regular shift, then they're staying late into the evening to serve the men. I couldn't do it without the volunteers. We have, residents, trainees, nurses, physical therapists, nutritionists, physician assistants, nurse practitioners, physician, I mean, just
The whole
everybody.
the whole realm
Yeah,
of
yeah.
the medical team.
Exactly.
Yeah.
See, everybody, we consider everybody at Cleveland Clinic to be a caregiver.
Oh yes,
Because
I
everybody
noticed
can play
that,
a
yeah.
role. Everybody
Uh-huh.
can play a role, educating, directing, so it's something I'm very appreciative of. I'm appreciative of the fact that, we've been able to do this for 16 years. The first year we had 35 men show up.
Okay,
And
I
now,
remember.
yeah,
Yes.
yeah, I mean, in the past several years, we've had over 1,000, 1,500, 2,000. And, speaking of the prostate exam, we're talking about the prostate exam, and it's a subject of comedians a lot of times.
Yes, especially.
But after these guys get that exam, they actually laugh at themselves and say, oh, is that all it was? I mean, that's what I was worried about. It takes like 3 seconds,
Of
5
course.
seconds,
And you have screens up so
Oh.
men can go behind the screen?
Well, actually, we're going to be up on the 8th floor in the Glickman Tower.
Oh, okay.
Private rooms, everything is private. And
Well,
again, we're
that's
not,
even
yes.
better, yeah.
And if a guy doesn't want to come in to get the exam, come in and get the blood test.
Okay.
And get the other screening. So, I mean, it can save your life. We check urine to check to see if there's any blood in the urine.
Yes.
Like a couple of years ago, we found a gentleman had some blood, microscopic blood, he couldn't see it. We evaluated it further, he had a huge kidney cancer.
Okay.
Required surgery, and, were it not for the Minority Men's Health Fair, he even admits he would have never come.
Good job.
Yes, thanks,
Good
thanks.
job. Now, for folks, as we begin to wrap this up, for folks who want to find out more about it or
Yes.
get information, give us the website or the email
Okay.
or if you have a contact phone number, and we will make those available as well.
Sure. So my office phone number, it's 216-445-7550, and that's 216-445-7550. My email, I'll give you my personal email. Love to have the individuals contact me. So it's modlinc, my last name, M-O-D-L-I-N, first initial C, then the @ CCF, like in frank.org. Website
We'll
is...
have that on the screen.
Yes,
Yeah.
and then our website is just www.clevelandclinic.org, then /MMHC.
Okay.
So Minority Men's.
So there's no
Health Center.
reason why you cannot get yourself to one of the men's health fairs, one at Cleveland Clinic campus, one at Lorraine, and one in Akron, unless you're busy delivering a baby. You know what I'm saying? That's ridiculous. Once they've had the screening tests at the health fair, what is the next step? Let's suppose you do find a little something, or you don't find anything. Do you have a follow-up email or letter saying, how do you put that if they need to come in for
Sure.
further testing?
Well, everybody, there are some tests that they undergo at the health fair. We give them the results immediately. Blood pressure, glucose, and certain things. But the laboratory tests, they require about a week or so for us to process those. And we actually mail out a letter to each individual health fair participant. If there's something that we consider strikingly abnormal, I will personally call them.
Excuse me, if you find, wait a minute while I sneeze again. If you find something abnormal,
Yes.
or what was that word?
Well, strikingly abnormal or
Okay, yeah.
worrisome, like a
Worrisome, yeah.
But see, we're going to send out letters to everybody.
Right.
But there are certain things that really stand out. I will personally call them, and that's why we ask for, like at registration, your address, your email. We're not trying to pry into their personal, but we want to have a way to contact them for follow-up.
them.
And the other thing is and as I said, we have a Minority Men's Health Center throughout the year. At main campus every Wednesday, at 70 Tubs every Tuesday. I'm at South Point twice a month. And these are opportunities for the men who come to the health fair or other men to register, formally to see me as a patient. But we also facilitate men to get in to see other specialists.
Right.
Primary care providers, cardiologists, GI, dermatology, whoever they need to see, we facilitate that. We have a very generous charity assistance program also. The men can fill out applications for that at the health fair or call my office and we can enroll them in charity assistance programs. We have pharmaceutical assistance programs also to help these gentlemen get access to medications. So we're doing what we can to break down the barriers to get the men to come in.
Let me interrupt and ask
Yes.
you this. For the men's health fairs that are conducted throughout the year, how do men find out about when and where those annual or throughout the year screenings
Yes.
are?
Well, the men can actually call my office, but we have a Department of Community Relations. And, as you say, there are a variety of, smaller events throughout the year.
Yes.
And so they can go to our Cleveland Clinic Community Relations website. They detail a lot of the information. They can go to our Minority Men's Health Center website. We have information about different upcoming events as well. But no, it's important that individuals take advantage of all their opportunities.
Exactly.
And we have opportunities at main campus. We have several family health centers, several regional hospitals, a number of opportunities for men and women and children to undergo screenings throughout the year.
And medical care, appropriate
Medical care.
medical care. And so April 19th will be here shortly, so clear your calendar. Make sure you come by roughly 5:30 to 8:30 p.m., free parking, and you'll get to meet, in some circumstances, Dr. Modlin, who founded this program at this Minority Men's Health Fair. And as I used to know, you were in charge of this all by yourself.
Well, I started, there's no way I could do it. This is so massive. Again, we rely upon the volunteers. And I always say, the men can come early also.
Okay.
We do start earlier, a lot of, we say officially 5:30, but some of the guys get there early and we get started. We're eager to go.
Well, that's good,
Yes.
because if you are a fella or your wife has to drag you there, come early, come right after work, right after, a little light snack and whatever. So we appreciate Dr. Charles Modlin sharing everything about this Minority Men's Health Fair, and we hope to see you there. So thanks again.
I really appreciate it. Thank you for having me.
Oh, you're more than welcome with that pretty smile.
No, thanks.
Okay, darling.
Thank you.
All right, and folks, stay tuned. We've got another special event that should make you want to follow through and join in a special event with Richard Asbury and his upcoming play read for right now. Okay, stay tuned.